As expected, the SARS coronavirus 2, which causes COVID-19, has now been detected in South Africa. We have currently 17 cases. Newest data indicates that all 17 cases had previous history of travel, or they've been in contact with somebody that's traveled to a country that is high risk. Everybody that has tested positive is in quarantine, and many of those who have been in contact has also been requested to self-quarantine. So currently it looks under control. Today it was reported that we have just under 130,000 infected worldwide and about 3.5% death rate. So it is still very similar to what we saw at the start of the outbreak, when 2% mortality rate was reported. I've seen figures recently that predicts at the end of the infection outbreak we would have an average of a 3% mortality. So it's remaining fairly constant. So I think it's very important to firstly state that the upgrade from an epidemic to a pandemic is no reflection on the severity of the virus. It is simply a measure of the spread of the virus. So for an epidemic, for instance, you would have a cluster of cases in a particular location infecting the population in an unexpected way. With a pandemic, it simply means that you now have the infection spreading to other countries, in other locations and other continents. So essentially a pandemic is multiple epidemics across various locations, and the disease can now spread slightly differently. You could now have person-to-person spread and non-traceable spread as well. So this is, once again, I have to reiterate, this is not a measure of the disease severity. It's simply now a spread of the disease to other locations. The University of the Western Cape has been very proactive in taking various measures. Early on, the university created a COVID-19 advisory group, which assesses on a daily basis the newest reports and newest outcomes of this disease and this virus. And based on this new accurate data, advice is given to the executive management of the university. The executive would then make decisions as to how do we contain an outbreak, should we have one at the university, and how do we best protect our staff and our students if in the event we do have an outbreak. We've realized that much of the panic among staff and students is due to misinformation about the virus and the outbreak. So we were advised by the advisory task team to meet with student leadership and hostel leadership staff to have an information session where we really spoke about the disease, the virus causing the disease, how it spread, for instance, how it can be prevented. So we looked at this virus in the information session from a research perspective, but also from a medical perspective. And students and staff were just really allowed to ask questions to get clarity on much of the information that they have access to. Turned out in the end that much of the information was misinformation. So in this age of social media, we need to be very careful as to the information that we share and the information we take as accurate. Please verify all information on the American CDC website, on the NICD website of South Africa, the UWC website, and the WHO website.